Welcome back to Tutorial Tuesday, everyone. Um, a question a lot of times people have is, in general, and there's a pun right there, in general anesthesia. They have, in general, this whole concept about anesthesia. And what procedures can you get under local, and what does local even mean versus IV sedation and general anesthesia, and what do all these terms mean? Well, let's just stop for a second and recognize that the idea for anesthesia is first and foremost to keep you safe and to keep you relaxed. And probably the last is to keep you pain-free. Because most of the time, the reason why you're not experiencing any pain is the medication that I'm putting in. And the medication I'm putting in, I could do that while you're awake, right? That's just an injection of anesthetic underneath the skin so that you feel nothing, just like if you may have had some dental work. That injection underneath the skin or in your mouth when you've gone to the dentist, that is called local anesthesia. Okay? Now, the Greek term for in the mouth is paroral, which means PO. And so I can also give you some medications by the mouth, or PO medication, like a Valium, which would relax you, or Percocet, which would take some of the pain away, or some other medications that will relax you or sedate you, and you take them by mouth and you get the local. You're always getting local. I'm always going to anesthetize it so you can't feel anything. But that won't take away your anxiety. That may not take away your nervousness. And that's why some of these other medications are beneficial. So I can also give you that by mouth, right? But it doesn't kick in for like a half an hour or 45 minutes. And then if you want more, well, I can give you another pill, but then you have to wait another half an hour or 45 minutes. So how can we make it that I can give you that medicine and the effect can be instantaneous? I can give you that medicine by the vein. And that's intravenous sedation. That's intravenous or IV sedation. That's when an anesthesiologist or a CRNA gives you medicine by your vein and either relaxes you or even makes you so sleepy that you sort of temporarily fall asleep. Medications that you may have heard of, like propofol, allow you to more or less turn a switch on and off, where when you get enough propofol, you literally fall asleep, and when you turn off the propofol and you stop having it drip in, you wake up. If you've ever had an endoscopy or some other minor procedure, you probably had IV sedation using propofol. But what happens when you get too much? What happens when you have so much of that relaxing medication that you fall asleep? Well, you fall asleep and the tongue falls back, and now it sort of obstructs your ability to breathe. Now, of course, we would know that, we would see that, right? It's not going to happen in front of us without us being aware of it. And if that's the case, we have to sort of pull the tongue forward so that you can keep breathing. But the way that we do that is uncomfortable. You'll start choking, right? If we put something in your mouth. So we have to sedate you even more. And that's where you start entering the realm of giving you medicine that really sort of puts you asleep. And that's the general term for general anesthesia. So most people associate general anesthesia with a tube that goes in your throat, but you could actually have enough medication on you so that we could put something that pulls your tongue forward without a tube, and that's arguably general anesthesia. So you can get general anesthesia without a tube in your throat, and arguably you can have a tube in your throat and not necessarily have general anesthesia. You could still be breathing on your own, and you could still be not nearly, and you won't necessarily get the gases that are associated that you may think is general anesthesia. So I know that's a long answer, but I hope it sort of clarifies these relatively fluid, different types of anesthesia, but it compartmentalizes them a little bit so you understand there's local, where I'm just infiltrating or filling an area on your face or body that gets numb, but you're awake, you're alert, if you're anxious, you're still gonna be anxious, versus doing that with some medication by the mouth called PO medication, which often does the trick, but if you need more, there's not much I can do because it takes 40 minutes for it to kick in, versus the IV sedation, which will have the effect almost immediately, and then you get into the general anesthesia.